Well, there's been a lot of criticism by the mainstream media, to say the least, about President Trump's claim that he's taking this drug, hydroxychloroquine. And while many so-called experts in the media, you know who they are, these hosts that have, I'm sure, a ton of medical experience, say that the drug isn't proven to fight COVID-19, our next guest disputes that a little. He's the former commissioner of the Federal Communications Commission, Rob McDowell. He came down with coronavirus, and he credits the drug for saving his life. Rob, welcome.
Thank you for having me.
All right, so let me ask you this. First, how are you doing?
Wonderfully. Thank you for asking. So since I was released from the hospital on April 1st, I've been vigorously trying to get the lung capacity back and get healthy, and hopefully meeting expectations on that front.
So when you came down with COVID-19, did you ask your doctor if you should take this drug, or did the doctor tell you that you should take this drug, or how did it come about that the drug became part of your regimen?
Sure. So I was in a tailspin on March 23rd. It ends up I only had a 20% chance of survival. Around that time, my primary care physician, Dr. Connie Lee, that's with one E, in Northern Virginia, who's amazing, was really fighting hard to get me on hydroxychloroquine. I'd never heard of the drug before that. And so at the hospital, they did put me on it. I began to stabilize within 24 hours or so. And I stayed stabilized. I wasn't gaining any altitude, but I eventually got better. That was the only change in my treatment. And that was the first time I'd ever heard of it. And then I got out of the hospital and found out that it had been politicized, unfortunately.
Rob, you have credited hydroxychloroquine to curing you. How are you sure that it really was specifically hydroxychloroquine?
Yeah, I mean, doctor, did your doctor say this?
So there were doctors in the hospital. This is Inova Fairfax Hospital, a very prominent hospital in Northern Virginia. And it wasn't just my primary care doctor's decision or recommendation. It was the consensus of the physicians attending to me at the time. And for sure, as a scientific, anecdotal one guy focus group, I can't say with certainty that it was hydroxychloroquine. There are a lot of people praying for me too, and that probably had something to do with it as well. But I was in a tailspin. The only change in my medication or treatment overall during that arc was adding hydroxychloroquine. I stabilized within 24 hours. And we're not going to know for a couple of years of double-blind, studies that are peer-reviewed and all that good stuff. Right now, doctors don't have time for that. And so the doctors in the trenches, on the front lines, hand-to-hand combat with coronavirus, thousands and thousands of them are seeing positive results from hydroxychloroquine. And we have to go with that as long as we can.
Rob, thanks so much for being here with us. Glad to see that you're doing well, and thank you so much for sharing your story with us.
Thank you. Best of luck to everyone.
All right, well, our next guest recently met with the president's doctor and spoke about the use of this controversial drug. We welcome Dr. Ronny Jackson, the president's former doctor. Dr. Jackson, thanks so much for being with us.
Hey, thank you guys for having me.
All right, doctor. So there's some folks in the media, we don't have to go through all their names, but there were some folks on the night after the president said that he was taking the drug that questioned whether he was even taking it. So let's just get this out of the way. Is the president taking the drug?
He absolutely is taking the drug. I verified that with his physician. We spoke about it at length right after the president made the announcement, and he's absolutely taking the drug. It's crazy that someone would suggest that he or his physician are lying about that. That's ridiculous.
So let me ask you this. You and Dr. Cassidy are military officers, right? So aside from being doctors and having an oath that you have to live up to, you have a military oath that you need to live up to. If the president of the United States told you that he wanted to take a drug and you didn't feel as though it was correct for the president or it posed a risk, would you prescribe it to him?
No, I mean, I wouldn't do anything to harm my patient. That's just, we don't do that. I would talk to the president. I would explain to him in great detail what I thought was the potential dangers of doing something like that. I would enlist everything around me I needed. If I had to talk to the first lady about it, if I had to talk to other folks about it, I would find a way to convince my patient it's not a good idea.
All right. Because I guess the other part of this is there's some of these folks in the media that are trying to make it seem like the president just randomly popped this pill. But I mean, I know from being there and interacting with you and the other folks there that you, both as military officers and as doctors, are not just going to pull off some stunt to make somebody happy. You're going to make sure that the people that you're taking care of are protected.
Absolutely, Sean. I mean, a lot went into deciding whether or not he was going to do this. You know, there were some exposures up there. We've seen those talked about the last few days. They took that into consideration. And, you know, they started asking the question, what else can we do to protect the president? You know, he's the leader of the free world. He's our commander in chief. He's our head of state. So they did what was responsible. They said, hey, we could give him this drug prophylactically, and it's certainly not going to harm him. And it may, in fact, keep him from getting this if, you know, if he's been exposed or he's about to be exposed. So they did the responsible thing in starting this drug. And that was in consultation with the president. And I know for a fact that the president's physician consulted with other experts around the country about this as well.
Makes sense.
Dr. Jackson, many people are saying there's so many risks to this drug. What are the risks out there?
Well, to be honest with you, there are no risks to this drug that I'm aware of that are significant in the setting that the president's using this. Now, some of the stuff that's been out there, some of the studies that have been talked about, it's comparing apples to oranges to some extent. First off, those studies aren't great studies anyways, but they're studies that were done on patients that are critically ill in the ICUs, and they're using huge doses of this drug as a treatment dose. The president's taking this prophylactically. The dose is much, much smaller prophylactically than it would be for treatment purposes. And to be honest with you, there are multiple people all over the country, in New York and other places, emergency medicine providers and first responders that have been taking this drug for months now as prophylaxis from getting this infection. I don't know of a single person that's been taking this drug prophylactically who's had a negative outcome from this.
Right.
And I just want to say one more thing. Prophylactically, this drug has been used since the 1940s for malaria.
I was going to ask you that same question. I know that people travel to places, countries, there's 100 countries where malaria is prevalent. And if you went there, that could be one of them, correct, that you would take prior to your trip to prevent malaria. Is that correct?
Yeah, it's not used as much anymore because there's some resistance.
But I mean, it's been used for a while.
It's been used. There have literally been over 1 billion doses of this drug prescribed.
That's quite a few. One more question, because then we're out of time. The president, a lot of folks in the media have been making this big deal out of whether the president's wearing a mask or not. He's traveling to the Ford plant this week, I think. Should he wear a mask?
I say that they can plan appropriately for the president to not wear a mask if he wants to. I think that's his preference. There's a lot of people involved in that. He needs to inspire confidence in all of us as our commander in chief and as our leader. He's leading from the front. And I think that I would recommend that if he doesn't want to wear a mask, I would figure out a way in conjunction with the place that he's visiting to make that not happen. And I think that's what they'll do.
Okay. All right. Well, good. Thank you for your medical insight. Appreciate that. Continue to stay safe. We look forward to having you back.
All right. Thanks, Sean. Thank you, guys.
All right. Well, political affiliation is actually having an impact on how quickly some people want to get back to work. And you might think, okay, we got an election coming up, so how's that going to impact it? We're bringing Dick Morris when we return to discuss just that. And when we return later, the vice president contenders are starting to emerge. Get out a piece of paper and a pen. We're going to play another round of Veep Stakes, and you can play along at home, too. We're back in just a moment.